Welcome to our channel HASHMICLINICS.
Welcome. Today's we're doing a deep dive into ARALIA RACEMOSA, or American spikenard. Now this is a really crucial remedy, but frankly it's often missed. It's indicated for some very specific respiratory and allergic attacks, and by the end of this, you are going to have the precise keynotes to prescribe it with real confidence.
So let's just start with the single most important line in ARALIA's entire profile. Honestly, this symptom is the Remedies calling card. If a patient gives you this, exactly like this, ARALIA should immediately be at the top of your list. It is the absolute #1 keynote.
All right, so here's how we're going to build the complete picture of ARALIA today. We'll start with its core identity, then move to the constitutional picture, its keynote symptoms, the incredibly important triggers and modalities, and of course, we'll compare it with some key remedies and finish up with some practical prescribing pearls you can use right away. Okay, let's dive right in. First things first, we need to define the remedy's absolute core. What is the central disturbance that ARALIA is actually all about? So, here it is. The crucial point is this triad. See, it's not just any cough or asthma, it's the unique combination of three things. 1, a spasmodic respiratory attack. 2, that specific timing. It all kicks off after that first bit of sleep or as soon as they lie down. And 3, a profound, almost violent sensitivity to the slightest draft of air. So now that we have that core idea, let's move on and see what kind of patient this remedy fits. What does the ARALIA constitution actually look like? Mentally, this is really interesting. The ARALIA patient often has this deep-seated, persistent anxiety that is just laser-focused on their lungs. We're talking about a fear of lung disease that they just cannot shake. And when you think about it, it makes perfect sense, given how intense their physical symptoms are. You'll often see this paired with a general kind of impatience, too. Physically, well, this patient isn't robust. Not at all. You're looking at a state of low vitality, real weakness, exhaustion, even prostration. And a couple of other general keynotes really stand out here. Those drenching sweats during sleep, and this characteristic acrid, corrosive quality to all their mucus secretions. From their nose right down to leukorrhea, it's all excoriating. Excellent. So we've got the general picture. Now let's really sharpen the image by breaking down the most characteristic symptoms, system by system. Now pay close attention here because what's really fascinating is the unique respiratory mechanic. You need to listen for it. The breathing is loud, it's musical, there's a distinct whistle, but the key diagnostic clue, the thing that will really help you, is that the inspiration is the primary struggle. It's loud and it's much more difficult than the expiration. This is a powerful, powerful differentiator from other remedies.
And in the world of hay fever, ARALIA is defined by that extreme sensitivity we talked about. I mean, the slightest draft of cold air can trigger violent, frequent sneezing. And that's followed by this torrent of discharge that is watery, acrid, and salty, and it literally excoriates the nose and the upper lip.
You know, even in the digestive sphere, we find these really peculiar symptoms. So after a loose stool, which might even come with a rectal prolapse, there's a very characteristic aching pain. But notice the direction. It extends upwards, and specifically on the left side. This is exactly the kind of strange, rare, and peculiar symptom that serves as an incredibly valuable guide to the remedy.
And in the female sphere, that same theme of acrid discharges just continues. We see a foul-smelling, corrosive leukorrhea, often with bearing down pains. And you should also look for a history of suppressions, maybe menses or lochia that got suppressed after an exposure, like getting chilled, which then leads to bloating and tympanies.
Okay, understanding the modalities, what makes the patient better or worse, is absolutely key to prescribing ARALIA accurately. This is really where the remedy reveals its true self. And this table just illustrates the remedy's entire rhythm perfectly. Look at this. Everything is worse from lying down, from sleep, especially that first short sleep, and from drafts. The time aggravation is often right around 11 p.m. So what helps? What brings relief? Well, anything that counteracts gravity and pressure on the chest, sitting up or lying with the head propped up high. All right, let's sharpen our understanding even more. How do we differentiate ARALIA from other remedies that show up with similar coughs or asthmatic symptoms? This is where good prescribing happens. This is a classic point of confusion, right? Both ARALIA and Romex can have an 11 p.m. cough, but the trigger is completely different. ARALIA's cough is set off by the physiological state of sleep.
Ramex's cough is triggered by a tickle in the suprasternal fossa or by just touching the throat pit. It's a world of difference. And this is a classic and absolutely critical point of differentiation. Remember how we said Aralia's struggle is on the inspiration? Well, chlorum is its physiological opposite. With chlorum, the inspiration is easy, it's free, it's the expiration that is difficult, prolonged, and suffocative. It really doesn't get any clearer than that.
And finally, let's compare it to pectin. The key here, the thing to look for, is the secretions. Aralia's asthma is mostly dry, it's spasmodic, it's wheezing. Pectin, on the other hand, that's your remedy for a humid asthma, where the attack ends with this gush of copious, tough, frothy mucus. So simply put, dry versus wet is your primary distinction.
Okay, so let's distill all of this down into some actionable clinical takeaways. How do we actually apply this when we're with a patient?
When you're thinking about Aralia, just follow this simple 3-step confirmation process. First, nail down that core modality. Does the attack begin right after that first sleep? Second, confirm the extreme sensitivity to drafts. And third, if you can, actually listen to the breathing. Is the inspiration the main point of difficulty? If you get a yes to these 3 questions, your prescription is on very, very solid ground.
And here are some of the most reliable memory aids to keep Aralia right at the front of your mind. Remember it when the patient is violently woken from their very first sleep. Remember it when hay fever starts instantly, the moment a draft hits them. Remember it when you can actually hear that loud whistling struggle to breathe in. And remember it when the background picture includes those peculiar acrid discharges or that unique upward shooting rectal pain.
We'll end with this thought to just sort of mull over. Consider the profound psychosomatic link here. Is that unshakable mental fear of lung disease a reflection of, or maybe even a contributor to, that desperate physical struggle to simply draw in a breath? It's this deep, deep connection between the mental anxiety and the physical keynote that so often points us to a truly well-indicated constitutional remedy.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.